Hello, my name is Travis Prouty, and today I'm going to give a brief summation of the Alice in Wonderland syndrome. Basically, the Alice in Wonderland syndrome, also known as Todd syndrome or Lilliputian hallucinations, um, it affects the human perception in a couple different ways. There's macropsia and micropsia. Essentially, micropsia is when you see things as much smaller than they are. So, for example, a lot of people who have the Alice in Wonderland syndrome will see their hands as being tiny. You can also see objects like a Coke can or a toilet or anything around you just looks much smaller than it actually is. Macropsia is the complete opposite of that. You see things as much larger than they are. For example, anybody that's seen the new Alice in Wonderland sees that giant head figurine. It's the same type of thing. You see things as much bigger than they are. And a lot of times that directly affects the human body. You see it as your own hands or feet as just much larger than the rest of your body, much larger than they naturally are. This is something that only affects you. The people around you see everything and you look the exact same. But for you, if you're suffering from Alice in Wonderland syndrome, you see things as bigger than they are. Typically, this is temporary. The Alice in Wonderland syndrome is just a temporary process. So a lot of times they're onset with migraines, brain tumors, and psychoactive drugs, which we'll talk a little bit more about in a second. History. Basically, it was named for by the book written by Lewis Carroll. Lewis Carroll wrote the book in the 1850s, Alice in Wonderland, and it was well documented that he suffered terrible migraines. And in 1955, John Todd, who is a British psychologist, noticed a lot of his patients were suffering from the process of seeing things bigger and smaller, and he decided that this is probably where Lewis Carroll came up with the concept of the Alice in Wonderland seeing things as bigger and smaller because of the fact that he was suffering from migraines and he was suffering the same thing. So he named it the Alice in Wonderland syndrome, but it's also called Todd syndrome, named after John Todd. Now, there is a drug, a psychedelic drug, which is a mushroom. It's a red and white toadstool, and this is a picture of the toadstool. Basically, the toadstool contains a psychoactive ingredient called mucimol, which is the active ingredient that actually causes the distortion. Signs and symptoms. Typically, most people have migraines first. You can also suffer from intoxications from hallucinogens, most notably the mushroom that I just spoke about. Brain tumors are known to cause the hallucinations. Also the Epstein-Barr virus, as well as the temporal lobe epilepsy. Now, interesting enough is mononucleosis is a precursor a lot of times for the Alice in Wonderland syndrome. There's not a direct connection. Scientists don't understand exactly why that happens, but a lot of people that suffer from these hallucinations originated with mononucleosis. So that's an interesting topic that hasn't quite been understood. Sight distortion. Again, this is a psychoactive part of our brain that's overreacting, and your eyes are physically okay. Nothing changes in your eyes as far as the physical nature of them. Your brain is what's distorting the image, nothing to do with your eyes. Typically, it's noticed in daytime, but people do suffer at nighttime as well. Treatment, the first thing they're going to say is get rest, relax. Same kind of treatment they're going to give for migraines because it's usually brought with an onset of a migraine or a pain in the brain is what's setting this up. Sometimes you'll take a nerve-blocking drug or an antidepressant. Different types of things to kind of resolve the pressure in your brain and relax what's going on. And that completes the process. Thank you for your time.